Hi, my name is Marie Romagnano, founder of Healthcare Professionals for Divine Mercy. I'm so happy to present to you our educational conferences that integrate medicine, bioethics, and the spirituality of divine mercy in patient care for healthcare professionals. Because of their importance, even if you're not a medical professional, we invite you to join us. Today, I wish to offer a summary of a conference presentation given by Dr. Helen Jackson on birth anomalies and bioethics. Dr. Helen Jackson is the past president of the St. Luke's Guild, Boston, Massachusetts, and the director of Doctors for Divine Mercy. She's actively involved in her private medical practice and is a speaker on various medical topics in the medical community. In this talk, Dr. Helen Jackson starts out by stressing the importance of prayer and by referring to the scriptural account of an elderly woman who was healed from hemorrhaging after she touched the garment hem of Jesus. She continued by reviewing the common obstetric problems and how to diagnose and treat. She breaks the first part of her talk and initiates a discussion on issues in each of the first 3 trimesters. In the first trimester, the most common problems are miscarriage, ectopic gestation, hydatidiform mole, and choriocarcinoma. In the second trimester, premature delivery and stillbirth. In the third trimester, placenta previa, preeclampsia, labor complications, and issues related to underlying medical complications of diabetes, thyroid disease, drug abuse, and more. She noted that one should be on guard for preeclampsia, diagnosed by hypertension and even thrombocytopenia. Eclampsia can result in seizures. The treatment for preeclampsia is individualized and may include seizure prophylaxis, medication to lower blood pressure, platelet counts, and intake and output. Ectopic pregnancy occurs when the fertilized ovum implants outside the uterine cavity. There is an increased morbidity if the diagnosis is delayed or missed. Predisposing factors include pelvic inflammatory disease, use of IUDs, and more. Diagnosis is made by blood pregnancy tests, serum HCG levels, transvaginal ultrasound, and one should avoid vaginal examination if the diagnosis is suspected. The junction of the fallopian tube and uterus causes the most serious ectopic pregnancies. Resection, partial or total, for the ectopic pregnancies is the preferred method of treatment. A saplinostomy or procedure only to remove the fetus is not recommended, as that is a surgical abortion. After resection, human chorionic gonadotropin levels must be monitored to make sure they return to normal. Dr. Jackson also discusses premature and term rupture of membranes, potential complications, and treatment. I invite you to listen to the complete presentation of Dr. Helen Jackson as she discusses birth anomalies and bioethics. You will find it very interesting. Thank you.
I'm back again at the request of Marie. Why are we not more physicians over here? My physician colleague said, you've got to be out of your mind getting a conference on Tuesday and Wednesday. Well, I will go ahead with my topic, but please bear with me. You know, God sends us crosses in many ways. Last year when I spoke with you, I mentioned that I lost my cousin Margaret, who was a physician, to cancer, and how she placed her whole trust in God, and which helped all of us. This year, of course, the good Lord sent me another challenge, and it was end of December, Christmas was over, so I spoke to my sister in India who had just come back from a trip. I said, how was the trip? I said, did you see my cousin who's a nun? She said, oh yes, Sister Scholastica was very happy to see us and all. She says, you know something, I have this numbness on the right side of my face. I said, oh, were you traveling, had the cold wind against your face, thinking, oh, she probably had facial palsy. And she says, no, it's worse than that. She said, I don't have any sensation on that side. I said, fine. What did your internist say? Oh, my blood pressure is up. She said, but the sensation hasn't gone. I said, you better see a neurologist. And she said, for what? I said, see what's happening. And so This was end of December. So January 3rd, I call her and she says, I have an appointment with a neurologist. Fine. January 7th, I go into the office. It's a Sunday afternoon, looking through my messages. And lo and behold, I get a note from her, MRI of the brain. 3 o'clock in the afternoon, Divine Mercy time. So I say, good Lord, I try my best to say the prayers, though Father Seraphim said we don't have to say it at 3 o'clock. And after that, I see, I'm wondering, what am I reading? 2-centimeter mass, distorting the fourth ventricle and the third ventricle. I'm reading, I said, is this my sister's MRI? And of course, I can't call her because it's 1 a.m. in India. So read it, trying to keep very calm, saying, God, help me with this. Couldn't wait to call her. I called her, and she said, what are you so worried about? This can be treated with medicine. I said, I don't know about that, but I said, you better see a neurosurgeon. So with some argument, and I said, after you've seen the neurosurgeon, pack your bags and come here. And she said, I'm not coming to the US for any treatment. Fine. So 8th, I called her. She said, the neurosurgeon said it needs to be removed surgically. Since she wasn't going to come, mountain goes to Muhammad or vice versa. So 9th, I call her and she's not herself. Her voice sounds terrible. Literally on Tuesday night, I got on my knees. I said, Lord, why her? I mean, she's good to everybody. She's always doing something for someone. Anyway, the synopsis is January 14th, I was supposed to go to Florida for a week. I'm en route to India. And of course, she had selected her surgeon, and we live in Calcutta in India, but she decided the surgery would be done in Madras, which is today called Chennai. And so I arrived there, and I see the surgeon, great guy. And you listen to him, no, not Catholic, listen to him, and he says, yes, she needs to be operated. My sister's heavier than I am. And I said, Doctor, I have full faith in you. What about the post-op care? And he's looking at me. I've done so many cases, so fine, no problem. And of course, Madras is not my hometown, and I'm saying, Lord, I'd still like to go to Mass every morning. Fine. Just put in the request to the good Lord, hoping he'd answer it. Interestingly enough, it's a secular hospital, surgical ward. As you enter the ward, there is this huge statue of Our Lady of Good Health. In Chennai, there's a shrine called Our Lady of Alankani. First sign, God was on my side. So I said, no problem. So the doctor tells her she'll be in the hospital, in the intensive care for 7 days, in the hospital for 8 days, and then she'll be okay. Meanwhile, of course, we say our rosary and everything, and she looks at me, she says, you know what? No one dies from this. I was playing ignorant as ever. Just a person, it's for support. I knew nothing about brain tumors, though I have to say I did research on it and talked to doctors at Mass General and at St. Elizabeth's. So there we are. Day of the surgery, she goes in. The doctor said it'll be about 7 hours or so. 8 hours. And excuse me. My brother-in-law, who's a Hindu, why are they taking so long? I said, they started late. Meanwhile, I run to the office. Any complications? They said no. And meanwhile, I can also see other medical personnel going in and out, so I knew there was something wrong. But you have to be the stoic person there, and the rosary beads, which are always with me. I said, bless him. And interestingly, she went into the operating room at 8 o'clock. 11 o'clock, my brother-in-law and myself went to the shrine for Mass, and we came back because we knew surgery wouldn't be complete. Finally, at 8:30, the doctor says you can come to the intensive care. Now, this is a physician who exudes confidence. But when we walked in, he was out of his scrubs and everything, but he was leaning against the wall. It took him 9.5 hours. And he's still looking at my sister, who's got tubes from everywhere. And he says, surgery was a success. I wasn't going to ask a question because we were still praying, storming heaven. And then he calls me aside. He says, it took long. Every time I went to the fourth ventricle, her heart would stop. and we had to wait. We had to have the bradycardia, that's the slow heartbeat, come back. I said, Doctor, I have full faith in you. I'm not worried about anything. And of course, the synopsis is every day I was able to go for Mass. How was that? They were very strict in India. 5 minutes in the intensive care is all that we got. So I'd go for the Tamil Mass at 11 o'clock when my brother-in-law was there. Now, of course, every day we didn't have the family transport to go. So guess what? We have three-wheelers in Madras. And the fun of it is, though we all speak English, I don't speak Tamil. So as I go down, I say shrine. And then they say, wait for you? I said, no, Mass 1 hour. We wait. So after that, I didn't need the family transport. I would just go down and the three-wheelers would be there for me. They would wait. Every day we were able to go to Mass and come back. All right. The other interesting thing was people of all faiths come there, but they all light a little candle in front of the statue. So one day, of course, taking my US background, I said, I think it's a fire hazard. And then I said, Helen, you stupid. The Blessed Mother is here. What are you worried about a fire? The synopsis is, okay, third day I go into the intensive care. She opens her eyes. She's getting all her tubes out. And she's looking very dumb. So I just showed her 2 sheets of the paper. I said, these are all the phone calls I have been fielding for you when you were in the operating room. And I said, everyone said they are praying for you. I said, if you don't think you're going to walk out from here, then think twice. So I said, you better breathe deep and get out and not disappoint all these people who have interceded to God. What impressed me most were men. My sister's friends' husbands would call me up and they say, Helen, we've been praying for her. How is she doing? One of our friends who's paralyzed, he would call regularly. And I'd say, Joseph, you know why you're paralyzed? He says, I don't know why God hasn't taken me. I said, Joseph, I'm the only one who can tell you that. Time for you to come back to the church. So in the midst of all this tragedy, I have to say my sister is doing very well, and I always take it to the good Lord and the Blessed Mother, who we've been praying incessantly to. She has some minor paralysis, but that's all, and she's back to work. But if it hadn't been for the good Lord's faith, if it hadn't been for the Blessed Mother's intercession, I would have been the biggest basket case. So as I say, for faith, God tests us every day, and we never know where it will come from. So I said, good Lord, I don't know what you're going to give me this year. All right, now coming to business in the US. You probably know the St. Elizabeth's Hospital is having negotiation with Ascension Health. Just say a prayer that we are the bright light that we are on the hill on Brighton, because we could do with a lot of prayers, principally because there are changes coming in Massachusetts. I know I was speaking to Allison earlier today, who is the pro-life director in Worcester, wanting to know if she is fully aware of the Religious Freedom Clause. Now, of course, there are so many things going on in politics that none of us are aware of. At least let me say I, for myself, am not aware of. But the good Lord reminds you in various ways, whether it's through TV news or email, that there are changes coming about. So all we need to do is to pray, ask the Holy Spirit for the strength to try in the best way we can to challenge these, because it's only our faith that will direct us, because we are Catholics and Catholic institutions have to be Catholics. Finally, just yesterday, I got a Press Ganey report. How many of you over here have filled out Press Ganey reports? Those are statistics of how we are doing, how the hospital is doing. And I don't know why they keep it confidential, because if anyone read mine, they'd know who it is. One, how long have you been associated with the hospital? Over 20 years, yes. In what department? OBGYN. And what else? Which other institutions are you affiliated with? Have you been in the same town? So they know. But the clincher will be, they said, is there one statement that you can make that will bring this hospital in its one change? Anyone want to guess what I wrote? Give a guess. Pray that the hospital will go in the direction of the magisterial teaching. So if anyone guesses who it is, it's I'm not avoiding my talk, but today happens to be St. Joseph's feast. St. Joseph the worker. The Blessed Mother will allow me to say a word about St. Joseph. The only reason my special devotion to St. Joseph was, for 10 years in India, I was in a boarding school, St. Joseph's, in a convent school run by the St. Joseph of Cluny nuns. After that, I went to St. Joseph's College in Darjeeling. Then when I came to this country, I was at St. Joseph's Hospital. Then when I moved to Boston, I was at St. Joseph's Parish. So if I don't have a special devotion to St. Joseph, I know. All right, now, Marie assigned this talk to me, Birth, Anomalies and Bioethics. So let's see. Of course, we start with the Divine Mercy. Marie, you're doing a great job, dear. And pray that we physicians get up and get moving. We try. So, Lord Jesus, I definitely trust in you. Psalm 27 is one of my favorite psalms. Put your hope and trust in the Lord. Take courage and be strong. It's interesting, my Hindu friend's father, who's 94, always keeps repeating it. And he says it in the environment where his daughter has MS. And all of us practically have to help her. But we get strength in it, but he always quotes this psalm. And I don't know if anyone can see that, so I'm going to say the prayer for you. It's a physician's. We need more than prayers. Lord, thou great physician, I kneel before thee. Since every good and perfect gift must come from thee, I pray. Give skill to my hand, clear vision to my mind, kindness and sympathy to my heart. Give me singleness of purpose, strength to lift at least a part of the burden of my suffering fellow men, and a true realization of the rare privilege that is mine. Take from my heart all guile and worldliness, that with thy simple faith of a child, I may rely on thee. Amen. You know, it's too bad these pictures aren't portrayed too well. Can you see this is supposed to be an ultrasound image? You can? Okay. This, at least the weeks you mentioned, is 11 weeks, and I'm sorry I don't have my pointer. As you face the picture, the cephalic or the head is to your right, and you find 4 little limb buds. So if no one says this is a baby, I don't know what else. Now this, 25 weeks, where is the thumb in the mouth? You know, this is 27, it's too bad that light is. Do we need that light? Anyway. This is the kid hiding his face. 28 weeks. Now, I can see it from here. There is the little one looking out at 29 weeks saying, I have to get out into that world. It's so cozy and comfortable in here. There we are at 32 weeks. And there, look at that little with the puckered lips. 33, we get there, ready to come out. Hiding my face. Feet up. You think we are the only ones who sit with our feet up. The little one has both its feet up, and I hope he doesn't remain breech. All right, now, when I was asked to give this talk, one thing I don't like is statistics, so here I'm boring you with it. Why do we have birth anomalies? There are so many factors. We try every day to try and prevent things from happening. Probably in a decade, or maybe not in my lifetime, definitely, everyone will have their own gene map so that they can look to see which deletion that they have, so that can be appropriately adjusted or restored or repaired. But for the time being, this is all that I have to present. Now, most of my data on this particular talk came from medical complications in pregnancy by Burrow and Ferris. Everyone says genetics. Genetics are the most of the reasons that cause our problem. So here we have chromosomal abnormalities. I take it with this medical audience, you know the basics of the chromosomes, namely the 23 pairs that all of us around here carry. Then all births, there are 0.5 to 1% of all births may have some chromosomal abnormalities. Now, it may be a single gene that is responsible, and the percentage is 1 to 2. Or there may be major congenital anomalies, which again give us 1 to 2%. Then we may have non-specific birth anomalies with a genetic component of 1.8, giving us a total of 4 to 5.6. Now, what are the morbidities associated with genetic disorders? Interestingly enough, spontaneous pregnancy loss. So the good Lord himself knows how to eliminate unwanted pregnancy. As the saying goes, humans seldom forgive, Mother Nature never forgives, God always forgives. But before the forgiveness, when there are abnormalities, God himself eliminates them. So that's why we have pregnancy losses. Most 50% of them have some genetic component. Stillbirth and neonatal deaths account for 5%. Surviving live birth, 0.5%, and potentially handicapped live borns are 10%. Now, this wasn't further divided whether it was related to prematurity or not. Let's skip this for the thing of time. I was surprised that severe mental retardation, there was a significant genetic component. So obviously these were not trauma related, which we obstetricians always face from our friendly attorneys. Because if there is a problem, we goofed. And again, with these genetic components, there may be just one single gene that's affected, or there may be a multifactorial cause. I know this is a busy slide. This again goes to tell us that now just to get into a little detail, each chromosome, there are certain genes that are selected. Now, if we have the same, I know I'm not doing a good job explaining it, there are some genes, if they are not manifested, may arise in the next generation if we get the same component when the egg is fertilized from the other half. So when a gene is hidden, it's called a recessive hidden gene. And if both the alleles are the same, then the transmission of that defective gene is greater. Most common anomalies which are compatible with life are cleft lip, with or without cleft palate. If there is one child affected, the incidence is 4%. If 2 children are affected, then it's 9. If there is one parent affected, there is a possibility of 4% of the offspring being affected. And if there is a parent and a child affected, the incidence is greater. Now, for cleft palate, it's more or less the same statistics. Single child, 2 children affected, 10, one affected parent, 6, and one affected parent and child, 15%. I know I shouldn't have put in the abbreviations. NTD means neural tube defects. And of course, everyone in this audience knows one of the preventive measures which has come out about a decade ago is to make sure that there is adequate folic acid in our diet. Folic acid these days, fortunately, most of the foods are fortified with it, but the average daily dose should be in the vicinity of 400 to 800 micrograms. The way I go about it, I ask my patients, do you take a multivitamin, do you eat greens, and do you drink a glass of orange juice? The triad of these will come akin to 800 micrograms. In the absence of that, I write either a prescription for 1 milligram folic acid to be taken daily, and this is principally in the women in the reproductive age group. And so neural tube defect, if there is Now, what are neural tubes? Anomalies of the brain and spinal cord anomalies. Brain anomalies, non-compatible life, which you'll shortly see, is anencephaly, where there is no development of the covering of the brain or the brain. Then coming down the anatomy to the neck, you may have protrusions, which we call meningoceles. And then further down, right to the end, is the common ones we run into are spina bifida. So if one child has neural defect, then there is a 4 to 5% incidence. If 2 children are affected, it's 12 to 15%. You know, this slide interested me, and that's why I put this up, especially with the chaos that has been happening recently for us Catholics. There are a lot of abnormalities which are, should I use the term, self-inflicted, though the poor children are the victims of it. In cases of incest, whether it is a parent or a child, brother or sister, there is a deleterious recessive disease to the extent of 12.5 to 25%, whereas the overall risk is 33%. Consanguineous twins. In India, we have a certain section where consanguinity is, should I say, rather common. But as an obstetrician, the only thing I saw in those consanguineous relationships was usually the mothers would be hypertensive. But there again, for obstetricians, preeclampsia and hypertension are something we encounter. So as seen here, aunt and nephew, the incidence is there, uncle and niece, and again, first cousin, second cousin, and unrelated. But you can see the statistical significance with these relations and the overall population. Okay. Now, I'm sorry, again, I abbreviated this. This was my quick way of getting things done, and I never went to the extent of correcting it. But I think everyone in this audience knows the common congenital heart disease, ventricular septal defect, atrial septal defect, persistent ductus arteriosus, pulmonary stenosis, aortic stenosis, tetralogy of Fallot, and coarctation of the aorta. All right, from the heart, I jumped to the foot. I was trying to go anatomically. Okay. Clubfoot, common. You can live in life with it. Congenital hip location, of course, many times after a breech babies, the obstetricians are blamed for it. And of course, we have to take it as it comes. Pyloric stenosis, one child, 3%. Mother of the offspring has had it, then 16. Interestingly enough, if the father of the offspring has it, it's only 5. Now, I haven't gone through the genetic analysis on that. Ethnic. Earlier on, I forget who mentioned about, religion. I think Marie did, on JACO. I was surprised JACO had so many questions on the spirituality. That's how much I look into JACO, except when they're coming to the hospital, I make sure I do not go to the hospital. Talking about religion, Massachusetts Medical Society, being on the perinatal committee, we were asked, why do you have religion in your questionnaire? And now it's my own office personal questionnaire. I'm not salaried by anybody except the good Lord. So I do have religion in my questionnaire. And so when they asked, I said, well, I'll give them the answer. I said, fine. I said, when somebody's very sick, they don't need me, they need the priest. In the case of Catholics or whatever religious denomination they are, and they're looking at each other saying, who put her on this committee? Then I said, now let's get to honesty, why I have it. If a patient of mine comes into the office and she writes no religion, I specifically ask her. I am interested in knowing who walks into my office who belongs to Jehovah's Witness. I respect all faiths. I respect their beliefs. But at that time, when I know it's not an emergency situation, I tell her where I stand. I said, listen, lady, you come in as an emergency. Do you put your faith and trust in me? I said, you may come in a situation, it could be an ectopic pregnancy, belly's full of blood, they're rushing you down, and you say, Dr. Jackson's my surgeon, I'll do all I can. But if you say, I am Jehovah's Witness and I will not take blood, I will still take care of you as your physician. And if you needed blood, I'll be, oh, no, I cannot do that. Then I say you're with the wrong physician. So we try to clear the air long before we run into the situation. But if we do, you just have to do it. And my answer is, fine. You know what you have to do? I'll do my best with God's help to give your life back. And then with the energy restored to you, you can do what you want. So we do have to ask about ethnic diseases. Tay-Sachs, predominantly with Ashkenazi Jews. Why do I ask this? Because if somebody is a carrier for Tay-Sachs, and if two carriers are joined in marriage, they have at least a 25% chance of having an offspring with Tay-Sachs. Now, what is Tay-Sachs? Tay-Sachs is an enzyme defect in the 15 chromosome. Correct me if any geneticists are here in the audience. This particular enzyme, the lack thereof, is responsible for this neurologic disorder, which is manifested as the child grows. When the child is born, beautiful, everything goes well. But as he or she enters, predominantly in males, enters his teenage years, he lacks his coordination and ultimately succumbs in his late teens. We still haven't found a cure for Tay-Sachs. Interesting thing, when I first heard this lecture in 80 by Dr. Kolodny, who is a geneticist and runs the Tay-Sachs Center, I said, Dr. Kolodny, trisomy 18, do you find this? And he looks at me and he says, why did you think of that? Because I said it's an enzyme lacking in the 15 chromosome. And if you have a trisomy, you should have plenty of this enzyme. Interestingly enough, children with trisomy, that's Down syndrome, do not get Tay-Sachs. What else do we have? Sickle cell, same thing, but sickle cell has come a long way, and probably pediatricians in the audience will be able to say more about it than I would. Now, for those of us adults, we may say our cholesterol is high, it's in our genes. Yes, it may be in our genes, but it's still, though it's familial in 50%, and thereby our offspring may get it, still there are ways and means of correcting it so that the high cholesterol doesn't affect our heart, our blood vessels, our brains, and our kidneys. Adult polycystic kidney is a sad situation because we have found no cure for it. I say we because I did work with some geneticists. That was oodles of years ago. Diagnosed early, but as of now, till they await a renal transplant from a suitable donor, dialysis is the only means of keeping them with a sustained quality of life. These are the other genetically transmitted diseases. I'll just touch upon familial breast cancer because, as you know, BRCA gene screening is available, but it's a two-edged sword. Do you want to know you carry the gene and feel as if a sword is hanging over your head? Or do you want to know you have the gene and say insurance companies are not going to insure you, and you're worried about when the breast cancer will develop, and will it be transmitted to an ovarian and breast cancer? So with all the knowledge we have these days, we also are met with challenges. Okay, now we come to the use of our ultrasound. In the first trimester, I didn't put this up because first trimester, as I said, if there are pregnancy anomalies, at least 50% are lost as spontaneous miscarriages. Before I go on to this slide, this last Saturday, the Guild of St. Luke sponsored a seminar on NAPRO technology. Just a show of hands, how many know what's NAPRO technology? Come on, somebody must know. Stand up, because my eyesight is also not good. I'm failing fast. Did I see a hand somewhere? Oh, yeah, good. Well, I'm glad at least somebody. You attended the conference on Saturday? No? NAPRO technology is Natural Procreative Technology, NPT. Pope Paul VI Institute in Omaha, Nebraska, has really put out techniques on trying to detect precisely when ovulation occurs. Now they say, there she goes again with her natural family planning. Talking of which, again, I pay my respects to Dr. John Billings, who just went to the good Lord on April 1st. He was the father of natural family planning. But NAPRO technology is utilized. As a matter of fact, it's actually good medical care. You sit and listen to your patients, see what their issues are, spend time with them, analyze it, and without much sophistication of all the medical technologies, try and get the answer. So what does this new terminology deal with? It helps women detect or observe. I said women, but it helps the spouses realize when the woman is fertile, or if she has other perimenstrual symptoms, address that. And these can be scientifically and successfully handled. And so this Saturday, we had a lecture on NAPRO technology, and one of the speakers said there is a specific type of mucus, I'm going into a few details, that is secreted from the cervix that eliminates defective sperms. Here I was in medicine all these years, and it was only on Saturday it was brought to my attention. So my question was, any studies being done on first trimester pregnancy losses that show that such individual lack this particular mucus? And guess what the audience said? That study is for you to do. So if anyone is interested in studying the cervical mucus, please come to me. I have no grants, but I have resource to prayer. All right, so I didn't put up any slides on the first trimester. So on the second trimester with our ultrasounds, the early ultrasound pictures I showed were from the website, and those are all normal babies. But when you can see in the second trimester when the head is not formed, or if it's a big head called hydrocephaly, or there is no brain developed, or if the head is very small called microcephaly. Then as you move to the neck, you may see a cystic mass sitting behind the neck. This is called a cystic hygroma. Cystic because it has fluid, and it's fluid filled. So cyst, a space-occupying lesion that has fluid. The significance of this is many times there's a chromosomal abnormality called Turner's syndrome, where one sex chromosome is missing. And when people see this, they say, oh, the person may have cystic hygroma, may have Turner's syndrome, but that cannot be a diagnosis made just on this study, on this one scan. Neural tube defects, as I said, meningocele, myelocele, and spina bifida. Okay, face I didn't mention because I said, cleft lip, cleft palate. Heart and lungs, the same defects I'd mentioned. Diaphragmatic hernia, later on I'll show you a picture where these days you can repair diaphragmatic hernia. Abdominal wall, sometimes there's no abdominal wall formed, or at the same time it's all shriveled up like in the prune belly. When you go to the gastrointestinal tract, there may be anomalies of the esophagus or the duodenum, which connects the stomach to the small bowel. Then with our genitourinary, it could be the bladder, and of course for our extremities, we have short people sometimes there are different types of dwarfism. Now, in my family, I cannot say short people because I'd have a battalion of them charging at me. Okay. Again, the most common genetic abnormality that is compatible with life but very difficult for society to accept. But any family who has had a child with Down syndrome will say they would not trade the child for anything or anyone in the world. And this is genuine, heartfelt love. Chromosome 12, as I said, we have 23 pairs of chromosomes. Chromosome 21 is called Down syndrome. Then I won't bore you with this. Now I'm jumping to fetal anomalies out of my time. I saw 10 minutes, Marie, I can see that. 5 minutes? 2, okay. You've never seen me move fast. This is anencephaly, all right, not compatible with life, but I learned from a patient who was carrying an anencephalic baby. I was covering for my associate, the most charming lady. She runs an anencephalic support group. She said when she was diagnosed with this, everyone wanted her to abort. She said no, brought the family together. She delivered the child, the whole family came together. They all held the baby, passed the baby around, comfort care, and the baby died in her arms. St. Elizabeth's, I'm plugging for the hospital. We have an excellent bereavement for infants. Oh, our pastoral care department is just superb. Everyone, and of course I can't say enough about our NICU either. They're so supportive. They take photographs, they take locks of baby's hair, but in this case there couldn't be any hair. But they have the photograph, they dress the baby well, and then they give everything in an album back to the mother. This is Potter's syndrome, lack of fluid. I'm skipping, Marie, chase me up. Okay. This is a success story out of St. Elizabeth's. I know I saw Jim McElhaney here. Is he still here? No, Jim was from St. E's anyway. Twin transfusion. Years ago, we had nothing to do. I say it's a success story because first we get early diagnosis thanks to ultrasound. But this, St. Elizabeth's had a case where we are in collaboration with Children's Hospital. The surgeons from there came, and with the aid of laparoscopy, they made a hole through the membrane. So there wasn't one twin that was feeding off the other twin, and burnt off the vessels in the placenta and helped the babies to go to viability. Oh, this is what I said, diaphragmatic hernia. Again, Children's Hospital in Boston have excellent results. It's amazing. These babies are barely 3 and 4 pounds, and what a marvelous job they do. They literally lift up the diaphragm, put a patch, as you can see in the white there, so that the intestine is pushed down through the hiatus and the diaphragm is repaired. Did I do it, Marie? Oh, just some genetic stuff. Down syndrome. Down syndrome, the Guild of St. Luke ran a seminar on Down syndrome, and I have to say my best friend whose first child was Down syndrome gave the most terrific talk. And the physician one was none other than the genetist from Mass General, Dr. Oh gosh, how could I forget his name? Dr. Lewis Holmes, who is not Catholic. But from 78, every high-risk patient of mine that I sent to Dr. Holmes, not one did he ever suggest termination. That's it. Okay. Thanks, Marie. Did it.